Hi guys, welcome back to Power and Poised, and I'm your real and raw Barbie, Deja, giving you everything real and raw. Today we are diving into all things women's health and wellness with Dr. Stephanie Hack. Okay, Dr. Hack is a board-certified obstetrician and gynecologist, a professional speaker, and an entrepreneur with over 2 decades of experience in women's health and advocacy. She's dedicated to empowering women through education, community programs, and the media. And she's constantly creating educational content for her own women's health platform, as well as serving on Elle's Magazine Beauty Advisor Board, okay? With her medical degree and a master's of public health, from Temple University, Dr. Hack has spearheaded impactful community health initiatives and served as a commissioner for the DC Lactation Commission. A skilled surgeon and educator, she has cared for countless women and championed advancements in holistic health. Dr. Hack's mission is to inspire women to live their healthiest, fullest life through informed choices and proactive self-care. So no further ado, welcome Dr. Hack to the pod.
Thank you. Thank you for having me. Deja, I love what you are doing. I think as many voices that we can have just lifting up Black women, women of color, addressing the issues that we need addressed with evidence-based information, as many voices as we can have are necessary. And I love that you are creating a space for women to have these conversations.
Yes, it takes, small change. It takes little steps, but the more we speak out and provide those evidence-based, knowledge for the community is when we'll start to see long-lasting change. So that is
Yeah.
why I was so excited to have you on because I personally feel like our mission statements really intertwine. And I just have so much respect for Black women who just pursue their career, be themselves in totality, and just make sure that they are passing on to the next generation. So, as I said to you guys, we're going to be diving all into women's health. So, can you please give us some myths and misconceptions that we have about our health? Because we know the media, especially with TikTok, is just giving us a lot of misconceptions, okay?
Oh, definitely. I'll start with the first one, which I think is all encompassing when we think about women's health, regardless of the age. But the first thing is we often give away our power to those who we expect to care about our health. And that means when you're going to your doctor, when you're going to your healthcare provider, we're looking at them saying, hey, I don't know what's going on. What do you know? You tell me. And the biggest misconception that I want to share is you are the expert about you. We
Yes.
are experts and we know very much about women's health, but I don't know everything about you. So don't give your power away. As your healthcare providers, we are here to assist you. We are here to consult you for you. We're not here to tell you what to do. We're here to listen, to examine, to put the information together and use what we've studied, what we've seen to try to figure out, okay, what makes the most sense for you? What's the most likely diagnosis for you? And once we've diagnosed, what makes the most sense for you moving forward to treat whatever condition you have, to prevent whatever it is that you're trying to prevent. So that's the first thing, just assuming that somebody else is the expert about you and giving them the power. Now, after that, there are like a bunch of little things.
Of
I'm on this
course.
I'm on this crusade now because there's a very dangerous and all too common trend that I'm seeing on social media with AI. And people are using AI avatars to give health information. And usually what they're doing is they're selling products. And I saw a post the other day. I've seen them on TikTok especially, but I saw one on Instagram. And the image was of like a young Black woman talking about she's speaking in front of a picture of herself and another woman, or a woman who looks close enough to herself. She says, me and my sister have been OGBYNs for over 20 years. Okay, now first, no, what's an OGBYN?
Clock
Okay,
it.
but she's
Clock it, please.
okay. first. And then she proceeds. Now, mind you, also in the picture of the two women hugging, one of the women has a tag on that very clearly says RN. Okay, but that's not the worst of it. So she says, we have been OGBYNs for over 20 years. Now, mind you, these women don't look a day older than you. So first, like, were you five? Like, what's the history for that? But then after that, she says, here's the information that women don't want to listen to, and then proceeds to go through like a number of like herbal or homeopathic remedies. Okay. And then you go to the page and it's just selling various things. It's like anti-aging. It's not the same woman. And a lot of times we don't do our due diligence. So I'm just going to give you a guess how many likes this post had. Just guess.
With AI, I'd probably say maybe like 100,000.
472,000 likes.
Wow.
472,000 likes. I mean, you think about it, like often the number of likes you get versus the engagement, the number of likes is less than 10%. Often the number of likes you get
Yes.
is like 1 to 3%. So how many people engaged with that misinformation? And that's just one post. I can't remember how many likes the account has, but there's so many of these accounts. And I can't remember why I brought this up specifically, but I just wanted to highlight that there's just so much misinformation, and something that I would encourage everyone to do is just have a skeptical eye. Like
Yes.
OGBYN, that doesn't make sense. RN, but I'm saying I'm an OBGYN, or excuse me, OGBYN. That doesn't make sense. And then going to profiles and looking, and I remember there was another one on TikTok, and you looked and it was the same thing. They're selling a product, but they're selling one thing that they present in every reel. Again, hundreds of thousands of followers, hundreds of thousands of likes. So you are really being targeted. You are being influenced. You are being marketed to. And I just want to, I don't want you to take on all of this information and continue to perpetuate this misinformation and these
Yes.
misconceptions and these myths. So just something to think about.
And oh my gosh, I think something first, I always do this. I keep forgetting this. Happy Black History Month. We are in our last week, even though Black History Month is every single day. What
Yes.
Dr. what Dr. Hack just gave us is also emphasizing the importance of education about Black history because this has happened for decades,
Mhm.
centuries. I'm not even going to say decades, centuries of the targeting of Black women because the reality is, since we were robbed of the education, we don't have as much knowledge about our health and just other things. And
Mhm.
especially when it comes to women's health, Black women's health was the formation, foundation for actual gynecology today. And if you guys
Yes, it
do not
was.
know that, please do your research. It is absolutely horrifying what they did to these Black women. But to see history repeat itself in a more updated way of the AI, I had no clue of that at all.
Hmm.
It's scary. So
It
to
is scary.
yeah, like we have to make sure we're not just having confirmation bias with everything or just believing what we see immediately because it's dangerous to us. It's our health. Health is
Right.
wealth.
Right. Yes, it is. And if you're not discerning, let's say you're just scrolling through, you're not paying attention, you wouldn't have known. You wouldn't have known. You would have thought, oh, that's just like a real post and we're critical reasoning skills are not something that's heavily taught in schools.
And
It's
I wonder
just
why.
not.
And I wonder why.
Right. Right. So use your critical reasoning. You are fully capable. You can deduct, you can see things, anything that makes you go, that's us. Like, that doesn't make sense. Like,
Yeah, if you gotta have a little side eye, make sure you open that other eye as well to really see what is going on.
yes.
And to
Hmm.
touch on what you said about power, understanding that your power is always within you. I love that you talked about that because sometimes it can be uncomfortable in these spaces, especially if you don't have a Black practitioner that you feel comfortable with to really share your experiences because Black women's health is completely different to our counterparts. So we're experiencing things that maybe our white practitioner might not know. They might not know, they might not understand, or they might place judgment. And it's also imperative to understand the root of medical foundations that they thought that Black people could not experience pain. So
Hmm.
understanding that that is still unconsciously in our medical field, it is so important to understand that your power is in your voice, and speaking up and being questioning them. You don't have to be rude per se, or even if you feel like it
Hmm.
makes them uncomfortable, don't be uncomfortable your whole life because you don't want to make somebody else feel uncomfortable.
Right. Right, exactly. And going back to what you mentioned about the long, and that's a belief that some, even some in training still have now, that Black people feel less pain. Now, the origins of that, right? And we know in slavery, it was more convenient to
Yep.
believe that Black people don't feel pain. That's called convenience. There's no evidence to prove that. There was nothing to support that, but it was convenient and then made you feel less guilty
Yep.
about the pain that you were inflicting.
And if you guys want to kind of go into more of a deep dive of what we're talking about, looking up white man's guilt, I do apologize that I don't remember the man who did the work on the young Black woman, on just a bunch of gynecology different practices, and they try to say he's the founder of
Oh,
gynecology.
yeah. Oh, I know. So I'll tell
Simmons,
you. So
Simmons.
J. Marion Sims.
Yes, J. Marion Simmons. Yes, because we will say
Just
that
Sims.
man's name.
Sims, Simms. But the women, so he leased from slave owners let me see. He leased slave owners, enslaved women, right? I don't want to call them, they were enslaved
They
women.
were
They aren't
enslaved.
slaves, they're enslaved women. He leased them from their owners, and he leased them to continue to practice certain methods and perfect his gynecological surgery technique, specifically the repair of fistulas. So, what's a fistula? And holes can develop between the vagina and the rectum, and that would cause, you could have feces coming through the vagina. You could have a hole between your bladder and your vagina. So then you'd have urine coming through your vagina. So they just create communications. So they had women who, probably through birth, that's the most likely thing, traumatic birthing experiences, who had fistulas. And you can imagine if somebody has feces coming out of their vagina, like that's not desirable, more for them, but also for their owners. And so they lease these women to try to help. And also, it's painful, it's not comfortable. And so he had these fistula repairing techniques. The women that we know who were documented were Lucy, Betsy, and Anarcha. Now, Anarcha was like 17 years old. She had over 30 surgeries. These women were leased to him for 5 years. And he would bring them into rooms, perform on them without anesthesia, because they weren't giving anesthesia for these procedures back then.
And we
And
don't
there'd
feel
be groups
pain.
of and we don't feel pain, so why would you even need that? Now, mind you, these women are screaming, yelling from the discomfort, but whatever, we don't feel pain. In these rooms of white men who are also trying to learn this technique, no consent, no nothing. And they called him the founder of a modern gynecology. Meanwhile, these women are really the mothers of gynecology. They're their unwilling sacrifice, right? Because this is not something that they wanted to do. This is something that they were forced to do. But their sacrifice has allowed us to develop surgical tools. We have a speculum, or excuse me,
Yes.
retractors that allow us to see in the vagina, called Sims retractors. And yeah, that is that history. You can go and find, there is in Montgomery, Alabama, which is where this happened, because these women were on plantations near Montgomery, Alabama. There is a monument that a Black woman created to honor these women. But yeah, this is history.
Then this is important, and emphasizing what you said again about you reclaiming your voice in the health field, because so many prior to us didn't even have the opportunity to have their voice be valid. So also
Right.
take it as a way, don't do the our ones before us and our ancestors a disservice by not speaking up for your needs, because they were the ones that are now giving us the opportunity to take care of those needs.
Yes. And if you're afraid, just start with a little speak up. Sometimes it's a muscle that needs to be built. It's an exercise, right? You do it a little bit, you get more comfortable. You can do it a little more. You speak up for others, you get more comfortable. You can do it a little more. Yeah.
Yes, and we're gonna kind of shift a little bit. That was your little take on Black history, okay? Because we need to really understand that this has everything is really ingrained in our society that sadly does work against us. And there's many people trying to continue to exemplify these voices of our ancestors to make sure that their stories and names are not forgotten because they are literally the foundation of almost every single thing in this country. And that is not bias, that is fact.
Hmm.
um, so we're going to get into a little bit of hormones and wellness because we know when the time of the month comes, we're feeling moody, we're feeling sad, or if we're intimate with someone, maybe we're experiencing different emotions, or our bodies are going through a bit of different changes. So, how would you recommend holistically to kind of regulate these hormones and manage them as well? It's a little bit of a broad question, but you can take what you're called to say.
Sure. So we have normal fluctuations in the hormones that we expect during a menstrual cycle. Like at the beginning of the menstrual cycle, we'll say your two predominant hormones. These are made by the ovaries, are estrogen, the ovarian follicles, estrogen and progesterone. So at the beginning of your cycle, your estrogen and progesterone levels are low. As the cycle progresses, your estrogen level starts to increase because the ovary is making follicles, the follicles make estrogen, so the estrogen levels increase about mid-cycle, they peak, they stimulate ovulation. Then there's another hormone that stimulates ovulation, but then your egg ovulates, and what's left behind forms something called the corpus luteum. And then that starts making progesterone, and your progesterone levels increase. And then your progesterone levels are higher for the end of the cycle, which is why you might feel a little bloated. You might have a little breast pain. You might be a little crampy. And then if you're not pregnant and there's no little embryo, then the corpus luteum dies, the hormone levels drop off, and then it triggers you getting a period. And then you begin the cycle all over again. So the best thing that I can say to do for just your hormonal health, your holistic health is eat healthy, move your body, and get sleep. And that's really the best things that you can do to support your hormonal health. Because if you are eating a lot of unhealthy food, that can throw off your hormonal balance. And the period really is kind of a vital sign. When you have abnormalities in your period, like irregularity, sometimes that can be a sign that there are other things that are abnormal too. So eating healthy, getting your rest, and eating healthy also means not engaging in other substances like alcohol, for example, like cigarette smoking. So you want to eat healthy, move your body, and get sleep.
So, in terms of exercising, so I know a lot of people, I am very guilty of this, do not like to go to the gym when they are on their period. So, what
Hmm.
are some exercises that you recommend that will still be not only stimulating to your body, but allows you to still, keep motion while not overexerting?
Sure. I mean, it's okay to take days off when you're on your period. You have to do what feels right for you, especially for people who have heavy periods. If you're losing a lot of blood, you're losing a lot of iron. Iron is necessary for taking oxygen all over your body. So if you're very anemic, you're going to have a hard time doing more vigorous exercising. You're going to get tired quickly. It puts a lot of stress on your heart. So if when your period comes and your body's telling you, mm-mm, girl, it's okay to listen to your body. And when you're feeling better, get up, move around, start working out again. But if you're just like, it's not that I have a heavy period. I just feel kind of bloated, kind of crampy. Don't underestimate walking. Walking is a great exercise. Get your pad, get your proper tampon. So this is for my girls who bleed heavy. So you can get out, walk around comfortably without that panic sense of like, I need to get to a bathroom. And then also dance. I feel like that's
Mm.
not something that people really consider. We don't think of it as a workout, but let's say if you're twerking, for example, that's your quads. Like that's your quads and your glute. You'll feel that. You do that for a while in your
Yeah.
quads. But any kind of dancing that you're doing and moving your body. And I have three little kids, so I'm constantly looking at little kids. But that's the thing about little kids, they move all the time.
Jumping
Like they don't
around.
just Always. They don't just walk somewhere. Their arms are engaged. If
Yes.
they're going there, they might be marching and lifting their feet up high. So anything that moves your body, sex, that can be exercise. Not everybody likes to have sex on their period, but just anything that gets your body moving, that gets your heart rate elevated.
Yes, I love that. Dancing is definitely underrated. That's why I take your Zumba classes, take some,
Yes.
find something fun. I think I also enjoy that you brought up just understanding yourself through your period, because sometimes it could be a
Hmm.
really low point for some people. I know I have heard some people and some people around me, especially like with their PMS symptoms, and it could just
Hmm.
kind of be a point where they're just like, oh, I hate everything. So I think giving yourself grace during that time is such an important
Hmm.
thing that, people talk about, but not really, because you can feel bottom of the barrel, which will then lead you to pull away from any positive wellness practices that you are doing and feel like you're starting fresh.
Yeah. Yeah.
And so, with some feminine wellness and self care, we can kind of sit on this topic for a little bit and let this really simmer into everyone's ears. Um, so we can get into a little bit of vaginal health first, and then just like some wellness practices as well to integrate. I know we talk a lot about like self care with like facials, the pedicures, and all that stuff, but we're going to dive into that a little bit later. Some actual ones we can do, or some of your suggestions. But so for just vaginal health care, what would be four of your core practices that you are like, this is a non negotiable? Everyone needs to find some kind of format that fits their body.
Mm. Well, I don't know if I'll have
I
four,
would say maybe three. I was
but
ambitious there. I was
I
ambitious.
don't know. Let's see. So, one, let's talk about cleaning your vagina. And really, you're not cleaning your vagina. But we'll talk about cleaning your vagina. Your vagina cleans itself. Your vagina has a whole process. It secretes fluids. You see vaginal discharge. It cleans and exfoliates itself. That discharge is made up of vaginal mucosa cells, in addition to other fluids that are secreted from the vagina. You don't need to clean your vagina. You don't need to clean your vagina.
The silence. The
Okay.
silence.
Your vulva. When you want to clean your vulva, all you need is water. Like that's it. There are a number of products, and I don't really fight people on this because only you know your actual vulva situation. And the difference between the vulva and vagina, the vulva is the skin, the tissue that you see on the outside. So if you just like put a mirror in between your legs, what you see is your vulva. The vagina is the hole that you see that you would use that blood comes from. And there are, three holes when you look at your vulva, primarily your urethra, where your urine comes from, your vagina, and then your rectum. So I would tell you all you need is water. Sometimes, especially like on the period, people will say, but like on my period, if you really want to use a soap, like a sensitive soap, an unscented soap, something like I usually just say Dove because that's easy enough for people to find. It doesn't have to be that. They don't pay me and I'm not endorsing them. But an unscented, an unscented bar soap, if you're on your period or if you feel like I really need to use something. And the reason for that is these things have chemicals that can irritate your skin. Vaginas, vulvas, they're sensitive. So you don't want to throw off your pH balance by introducing some kind of fluid, some unnecessary substance into the vagina. Vaginas are sensitive. On your vulva, same thing. You can be irritated by a scent that's added to a product. You don't want to put harsh chemicals and things on your vulva. Do you need all of these wipes? There is a huge industry that is created to make you feel like your vagina and vulva are dirty and
Mm,
are smelly.
mm.
And you don't need a lot of these products. I repeat, because I know that when I was young, I thought, and I would use all the sprays. And I'm like, you don't need that. this is for most people, for the deodorants. I know people talk about the whole body deodorants. Some people find them helpful. Generally, I tell my patients you don't need that. If you find that you've used it and maybe there's an odor you're concerned about and it's helpful, then good, and it's not bothering you. And that was always my feeling with my patients. Like if there's something that you like to use, it's not bothering you, that you can tell you're not having any itching, irritation, abnormal discharge for you, you can use it. But generally speaking, you don't need to use something. And I know this is especially for your audience, for young women, because we're not really told this. And young women, you are especially marketed to.
Very much.
Um, yes. So what did I say? I said
We'll
we talked
take
about
that.
cleaning.
We'll take that. That was
Okay.
a great deep dive on that. And you could just give us kind of one of your favorite wellness slash self-care practices that you integrate to, kind of encourage better feminine health as well.
Oh, well, my wellness isn't specifically feminine health, but the feminine health benefits. I love to meditate.
Mm,
And you can meditate in a lot of different ways. You don't need a lot of time. You don't need somebody else to do a guided meditation for you. Although guided meditations can be nice and they are everywhere. But taking 10 to 20 minutes a day to just sit in silence, maybe you can listen to like a white noise machine or just listen to some nice calming music, nothing with words, something that you're not really going to think about, but just to sit in silence. And I really like that because it's a good practice for building time for yourself.
mm,
And I think this is especially true for people who are caregivers. When you become a caregiver, it's a lot harder to make time for yourself. But being in the practice of making time for yourself helps you continue to um, maintain a practice of making time for yourself. And then the ability to make time for yourself and care for yourself in that way kind of permeates to the other areas of your life, and
exactly.
that you're in a better habit of caring for yourself than maybe someone who does not or cannot.
Yes, that's why I love just different self-care practices, just really all integrate with your overall well-being. Just like you said,
Yes.
meditation. Sometimes sitting in silence, you'd be like, I do kind of feel a little off, or, I didn't really feel like I spoke up enough at my last appointment. I'm gonna see if I can reschedule, or I'm gonna see if I could. It kind of gives you those insights and just allows you to silence the outside noise of the world of we heard
Mhm.
all of the misconceptions and all the way we're targeted and marketed. We need a moment to just stop, breathe, and listen to ourselves.
Yes, and you can walk. You could have a 10-minute or 20-minute walk in silence, and just allow your brain to just calm down. And, it doesn't have to be sitting somewhere. You can move if that's what you like to do, a walk through nature. But yeah.
So we are going to get into our last segment, you guys. Dr. Hack has been giving us all the gems, okay? At this point, if you listen to this episode and you're still a little confused, maybe listen again and listen to her podcast. However, we are going to dive right into our fact or fiction myth busting because, as we've been addressing throughout this whole episode, there's a lot of misconceptions about women's health, as well as we are being targeted for profit to that may not even really benefit us health wise. Most of the time, they're
Hmm.
not. And we could just solve a lot of things on our own. So, we're going to have 5 hot topics, 5 hot things that we are misconstrued about. And Dr. Hack is going to tell us if it's a myth or not. So, our first one is going to be boric acid cures every STI.
Pause. I don't know boric acid. I mean, in practice, we use boric acid for people who have certain types of persistent vaginal infections. Like if you have persistent bacterial vaginosis or BV, then boric acid might be recommended. You get it from a compounding pharmacy. It's a whole process. That is the only thing in practice that we use boric acid for. So that is false.
Drinking cranberry juice will prevent or cure UTIs.
So it depends on the person, it depends on the bacteria, but cranberries have a chemical that helps or prevents bacteria or decreases the likelihood that bacteria will attach to the bladder wall. So that can be helpful. So I guess we'll say true because there is some help. Now, if you have a UTI, please go get your urine checked and take the antibiotic. Don't just say, I'm going to drink cranberry juice because that can cause a very severe infection that goes from your bladder
Mm.
to your kidneys. Then it becomes pyelonephritis instead of just an uncomplicated UTI. So, but if you're like, hey, I like to drink cranberry juice, drink cranberry juice that's not with no sugar added because there's no reason that you don't want to keep getting the sugar because the sugar can cause other problems.
Yes, I was just gonna make that clarification as well. Only true cranberry juice, please.
Yes.
um, Birth control causes weight gain in everyone.
No, birth control does not cause weight gain in everyone. Multiple studies have come out saying birth control does not cause weight gain in anyone.
Wow.
With that said, birth control can cause water retention. Like anecdotally, if you ask an OB/GYN, we'll tell you that we've had people who, I mean, I can even say for myself when I was younger and I was on one specific birth control pill, I can't even remember what it was now. But when I took it, I gained 5 pounds. When I stopped taking it, I lost 5 pounds.
Mm.
So to me, even if I say, well, it's not going to cause weight gain, it's going to cause water retention. But if in that water retention, you're actually looking at the scale and weighing more, it's weight gain to me. So for some people, yes. And there's one specific birth control, Depo-Provera, which most commonly people experience. Not that most people experience weight gain with this one, but of all the birth controls, the one that people most commonly complain of weight gain with is Depo-Provera, the
Mhm.
shot that you get every 3 months. So some people can experience weight gain when they take birth control. Not everyone. I remember I had a patient who took Depo-Provera because she wanted to gain weight and she was still just as skinny. And I thought, that is a blessing for you. You don't see it now.
That was so real, but so funny at the same time because you gotta cheat the system sometimes.
She was trying, it was not working. Mm-mm.
Vaginal discharge is always a sign of an infection.
No, you should have vaginal discharge. You will also have increased vaginal discharge around the time of ovulation. That is very normal. That is expected. Your vagina is constantly cleaning itself. You should have vaginal discharge. You should know your baseline discharge. And if you see a change from that, like a change in color, or you're experiencing other symptoms like itching or irritation, or odor, then that could be concerning and that could be a sign of infection.
And last, but probably one of the most important ones, you should douche to keep your vagina clean.
Oh my gosh. Well, if you are listening and I want to know what you think. Not you, DH, I know you know. So I want to give them a chance to answer. And if you've been listening and you've been vibing with us this whole time, your answer should be that is a myth. No douching, contrary to what your mother might have done, or your grandmother might have done, or your great grandmother. They didn't know. They didn't know. So, douching in our vaginas, we have a vaginal environment. It's called a microbiome of different bacterias. We also have yeast. Yeast are a normal part of our vaginal environment. And douching can throw off, they've kind of come together and created this community. Everybody has a role, everybody has a job, they're working in harmony. Douching can throw off that harmony and then cause certain types of bacteria or yeast to overgrow, and then you can end up having an infection. So, no, no, no douching.
No, 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 no. So this episode, we brought you all things wellness, hormonal health, misconceptions. We even gave you a important, not even a little, an important piece of Black history that is directly associated with gynecology. So I want to personally thank you, Dr. Hack, for giving you all of your wisdom to us, as well as your constant, practices and constant methods to make sure that this knowledge is being spread to the people who knows, as well as being a pioneer and a powerful Black woman in the medical field. So please, if you have a tiny wellness tip, like a small sentence to just leave us off on, and then you can tell everybody where to find you.
So, I would say take care of yourself in any way that seems fit. Take care of your mental health. If you think You might need a therapist. You need a therapist. Take care of your physical health, moving your body, and take care of your spiritual health. You have to have things that you believe that help motivate you and make you feel good about this beautiful, amazing life that you've been blessed with
Come
and
on.
given a purpose for. So, yeah, that's what I would say. And if you want to find me, my platform is Lady Parts Doctor, written out the whole word. It's a platform where I provide evidence-based information, health information for women about spiritual, physical, and mental health. And you can go to ladypartsdoctor.com. You can follow me on Instagram at ladypartsdoc. DOC. You can follow me at TikTok at Lady Parts Doc and Threads at Lady Parts Doc, which I think is where I met you. Did I meet you on
Yes.
Threads?
Yes, yes. Threads is a community,
um,
y'all.
it is a community. I love the vibe on Threads and also on YouTube, but ladypartsdoctor.com. Check me out there. Oh, and most importantly, check out my podcast. It's called
Yes,
Lady Parts
duh.
Doctor.
Yes, the episodes are
Yeah.
amazing, you guys. Please listen in. Please support Dr. Hack because she is going to really help you out so many ways, so many more ways than you can even imagine. But this was another episode of Power and Poise, where we are regaining our power and staying poised at the same time. Thank you guys so much for listening, and bye.
Bye.